Water. It's something that we drink every day, and we drink it without ever thinking about where it came from, if it's clean, or if there will be more tomorrow. Living in the US, we are very fortunate to not have to worry about these issues, but in many parts of the world, they are major problems that people face daily. According to the World Health Organization, over 10% of the world's population does not have access to improved drinking water. That is, 780 million people are drinking water from an unprotected dug well, an unprotected spring, or surface water. Though the world met the United Nations Millennium Development Goal in 2010, if current trends continue, 605 million people will be without an improved drinking water source in 2015. I witnessed firsthand the need for improved water sources and quality when I went to India as a child. When I visited my grandparents, who live in a small village, I saw that people were drinking water from a well that was open to any contamination in the air. I also saw many children were sick because they had been drinking dirty water. In fact, WHO data indicates that waterborne disease remains the leading cause of death for children under the age of 5. Tufts professor Danielle Lantag has worked as a public health engineer at the Centers for Disease Control and Prevention and most recently did a fellowship in sustainability science at Harvard Kennedy School. Since 2000, she has provided technical assistance to and evaluation of water treatment programs in more than 40 countries in Africa, Asia, and Central and South America. I recently spoke with Professor Lantag to hear her thoughts on the global water problem.
Diarrheal diseases are one of the three main causes of death for children worldwide, along with acute respiratory infections and malaria. And so to prevent diarrheal disease, we look at providing water and sanitation interventions to reduce the burden of mortality and morbidity on particularly children in Africa.
Doing some quick research, I learned that 3.4 million people die due to water-related diseases each year. I knew that I wanted to be involved in trying to fix this global problem. Throughout my time in college, I have learned a lot about improving water quality and access in developing countries through my work with Engineers Without Borders, in which we work in a small community in the Dominican Republic to help fix their water infrastructure. And about a year ago, I helped found an NGO called Spouts of Water, which is an organization aimed to increase the access to clean water in Uganda. Spouts of Water works on the premise that the best method to create a system that promotes clean water access is by doing it sustainably, using local materials, keeping the cost low, and making sure it is socially acceptable. We have built a factory in Kumi, Uganda to create and distribute ceramic water filters that are made through local materials such as clay from nearby deposits and unused rice husk. We also use a financially sustainable model that allows local workers to pay their own salary while having extra money to purchase the materials to make more filters. Though ceramic filters are not the most advanced method to purify water, their simplicity makes them a great way to clean water in developing countries.
Sometimes the simplest options, chlorine tablets, good chlorine, or ceramic filters are the ones we find that have been used most frequently in the long term to reduce disease in the households in developing countries.
Our Spouts of Water team is very proud of the work we have been able to do over the past year and a half when we started with the idea. However, as I have thought more about the project, I realize that there are many more improvements that need to be addressed in order to make the Spouts model a comprehensive, improved water access system that benefits its users the most. As I spoke with Professor Lantag, she discussed some important aspects that we had not fully considered when we started the project.
Yes, we all know that we should wear our seatbelts, we shouldn't smoke, and we should use condoms during sex. That doesn't mean we all do those actions. It's not enough for people to do actions because it's good for them. We need, because there's a health benefit, we need to think about what are the actual drivers of behavior change. They're legislation in the case of seatbelts. They're thinking about personal connections. Some of the smoking cessation campaigns have the best impact when grandchildren say to their grandparents, but Grandpa, I want you to be around in 10 years. that changes behavior, those personal links, people that you care about wanting you to change behavior. The ideal goal worldwide is that every household should have pipe-treated infrastructure water delivered safely into their home. We know this has the most health benefit. We know this doesn't depend on individuals having to treat their own water.
Learning about what more is involved in improving the access of clean water, I researched how other ceramic filter-based production facilities attack these issues and was surprised to see that very little is being done. Two of the more successful ceramic filter production organizations, Potters for Peace and Resource Development International Cambodia, other than working on their ceramic filter technology, had just a small teaching component as part of their system to help children understand the importance of clean water. Therefore, I propose a three-part plan to tackle the issues of improved technology, behavioral change, and advocating for better water policy. First, the ceramic filter technology used to clean the water must be improved. Right now, the filters Spouts aims to reduce use a mechanical barrier created by the pores in the filter that stops a lot of the hazardous materials in the dirty water to flow through. For added purification, the filters are coated in a layer of silver nitrate, which acts as a biocide by disabling the particular enzyme that pathogenic bacteria and fungi use for oxygen metabolism, thus suffocating them. However, this method does not kill viruses. The easiest way to kill viruses in developing countries is through chlorine treatment. After thinking a lot about the different options to combine the beneficial nature of silver nitrate and chlorine for disinfection, I propose developing a two-part filter system that has water first go through the silver nitrate layer and then the chlorine layer. The benefits for this are that the water is being cleaned in a simple manner by pouring it into the filter, and this would also remove the human aspect of having to rely on the user to maintain proper dosage of chlorine during every use. Next, I realized that spouts of water is not necessarily going to improve the health conditions in Uganda, even if our filters are extremely effective. Creating real behavioral change not only requires improved science, but also a reason for people to make those changes. I want to capitalize on the idea of using personal connections and people's trust to get them to change their behavior. Spouts' current plan is to partner with NGOs to aid in the distribution process. But I realize that we should focus on personal connections that actually make people want to change their behavior. This includes going into schools and not only teaching children about the importance of clean water, but also teaching them about how to talk to their parents about it and express that they want clean water so that they can all be healthy in their family. While I was in Uganda this summer, I saw how strong the connection people have to their churches. Therefore, we should work with the priests of each church to advocate for drinking clean water. Furthermore, we should work with local hospitals, clinics, and midwives who talk to sick people daily. By explaining how drinking clean water may help with curing them of their problems, or how drinking clean water is important to make sure that the baby you are pregnant with is healthy when born, we are more likely to cause a real behavioral change and have people being active in drinking clean water. Finally, I realize that ceramic water filters and personal water treatment is really just a band-aid approach to the problem in developing countries. The eventual goal is to have treated piped water go to every household so that we do not need to rely on individual users to take care of their water. Though it would take many decades before the government would agree to fund this, it is important to start advocating for investment into water and sanitation infrastructures now. Spouts of Water can do its part for advocating by measuring its impact on overall health and improved performance at work through quantifiable data, surveys, and interviews. All this evidence can be taken to the Ugandan government as reasons to help fund these large-scale water treatment-based systems. To help aid this process along, it would seem most beneficial to create public-private partnerships in each village that can be in charge of advocating and implementing community-wide based water treatment systems. Through these three aspects of improved technology, behavioral change, and advocating for better water policy, Spouts of Water can fill the gap in international development NGO space of real improvement in the access of clean water. Currently, there is not an emphasis on attacking the global water problem on the whole, and it is not sufficient enough to focus on technologies that will only benefit people in the short term. I believe that Spouts of Water can really change the way international development NGOs work and be an important player in causing change and helping solve the global water problem.